Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hi, I'm Geraldine Cambron. I'm the president of the Massage Therapy Foundation. Thank you for joining us today with Research Perch, which is a podcast put on by the Massage Therapy Foundation. I'm here today with my cohort, Ruth Werner. Ruth, hello.
Hi, I'm a cohort.
My partner in crime.
Great. And we're here to talk about a really exciting article. So, Geraldine, you want to give us the long title of this article?
Well, people don't fall asleep to this title. It is very long, which is unusual, but I guess not so unusual for a review article. The title of this review article is The Impact of Massage Therapy on Function in Pain Populations, a systematic review and meta-analysis of randomized controlled trials. Part 1, Patients Experiencing Pain in the General Population. This article came out in Pain Medicine in 2016, so it's very recent. It just came out. It was released electronically initially and then is coming out in hard copy. And it was an article written by Cindy Crawford et al. So we want to talk about it a little. So what happened in this article?
Yeah, so this is a huge piece of work. And as you heard in the title, this is part 1. This is actually a 3-part article. The one we're going to talk about today is the impact of massage therapy on pain and function in general populations. Future articles will be talking about specifically cancer populations and surgical populations. But this is the one that's sort of the more general picture. And just to give you a tiny bit of background on this, the first thing for all of our listeners to know is that this is the first Research Perch where we are talking about an article that was not published in the International Journal of Therapeutic Massage and Bodywork. That's the Foundation's academic journal. This one was published elsewhere, but we made sure, with the support of the AMTA, that we are able to that this article will be available free full text forever. And so anyone who's listening to this, we really want you to get this article, download it, and look at it and live with it for a bit, because it's a big piece of work. And 20 minutes of Research Perch is not going to really unpack this whole thing, but it'll give us a good start. And even though it's not an IJTMB, you can get at it, and we'll make sure to put the website for where this is available up on the screen when we do our final edit of this piece. So several years ago, the Massage Therapy Foundation decided to ask a big question, which is, what is the state of the research about massage therapy for pain? And we decided actually to expand that, because it's more than about pain. It's about pain and function. And those two things are very tied up together, because what we see is, as people have less pain and their function increases, sometimes they will, do things in such a way that their pain returns. And so it gets very complicated. So we wanted to make sure that anything that we did that was an overview of what the research says about pain includes what the research says about function in the context of massage therapy. And to do this, we decided to work with a research institute in Washington, D.C. called the Samueli Institute. And they have a specific protocol for how to do these large-scale projects. And so we decided it would be a good idea to work with them on doing that. And that's who Cindy Crawford is the lead. She was the lead sort of project manager, and that's why she's listed as the lead author. However, it's really important for our listeners to know that the Samueli Institute is one of the reasons we wanted to work with them, is that they work closely with the Department of Defense. They have a lot of ties into military medicine, and that was part of the audience we thought might be really interested in learning about massage therapy for pain and function. And so we had representatives from Samueli, we had representatives from the Department of Defense, and then we also had subject matter experts in massage therapy sitting around the table, create what this project would look like. And basically its function was to gather the research that met a criteria of rigor that addresses questions about massage therapy and pain and function. And to do that, we had to do things like define what was going to be massage therapy and what definition of pain we were going to use and how, what were the parameters of function, whether that was sleep or mood or ability to work or activities of daily living. And so, as you can imagine, this was an enormous undertaking, and we felt that the research base was deep enough for us to dig deep and look at that. So that's where this article came from. So Geraldine, do you want to talk about where this fits when we talk about the research pyramid and strengths and weaknesses of this kind of design study?
Oh, I'd love to. And one thing I'd like to add to your synopsis is that just as full disclosure, this study was funded by the AMTA through the Massage Therapy Foundation. So the foundation decided that this was a study that was necessary and important to do. In having that happen, Ruth and I actually are authors on this article. So just to disclose that, we were not the researchers on this article. The researchers were the ones that pulled the articles. We were kind of consultants on it. We were part of a working group that talked about all of the different outcomes that they were finding, that the researchers with Samuel Institute were finding. So this is a systematic review, and when we look at the strength or the hierarchy of study designs, the systematic reviews and meta-analyses are at the very peak. So I don't know if you've seen the hierarchy of evidence pyramid before, but if you haven't, it's something worth looking up. And there's different types of study designs, starting from opinions and case reports, which are just one single subjects, and moving up through observational studies and clinical trials. And at the very top are these review articles. So there's different types of review articles. There's narrative reviews, there's systematic reviews, there's meta-analyses, with meta-analyses being the strongest type of article, which is what this is. And so, yes.
Can you talk about the difference between a systematic review and a meta-analysis?
Yes, they are very similar. A meta-analysis actually is, pardon me?
Similar but not synonymous.
Yeah, well, a meta-analysis is a systematic review plus, and it's a higher level than a systematic review. And what a systematic review is, just like it sounds, it's a review that is systematic. And so the authors or the investigators will spell out, here are the databases we searched, here's our search strategy, here are the number of articles we found, here's how we decided whether articles should be included or excluded. They tell you all of that so that you could even do the same search and find the same articles. Or, if this, for instance, this study went through, I think, the end of 2014. So if you wanted to see what research has come out since then, you would do the same search in the same databases and find the new knowledge that's coming out that could be added to this. The meta-analysis then is adding a portion to it where the investigators actually will take data from each of the articles that they settled on and do a big analysis called a meta-analysis of all of that data. So it's pulling data from each clinical trial that they decided should be included in this review and collapsing it all together to come up with one response or one answer to their question.
And by data, we're talking less about people's experiences and how they describe that, and more about statistical analysis?
Mm-hmm. Yeah, that's a really good question. Good point. In order to collapse this information or this data, it has to be numeric. And so in meta-analyses, they look for the same type of data. So they can't collapse apples and oranges. You can't put range of motion outcomes with pain outcomes. They have to be all pain outcomes from each of the different articles. And so it does have to be numeric, and it is collapsed together as long as it makes sense to collapse it together. And that's one of the weaknesses of meta-analyses, is it's uncommon for all articles to use exactly the same outcome measure. And so, we don't want to compare apples and oranges and lump them all together and think, well, here's our result. that doesn't make any sense. And so really with meta-analyses, one of the hard parts is making sure that you find articles where you have the same type of data in each of the articles in order to collapse it together.
Right. Well, and so one of the really, in my mind, one of the really important outcomes of this project was we worked together with this team to determine some reporting standards, so that is now published. So we are really encouraging that future researchers into massage therapy will begin to use similar ways of talking about what they do, which is going to make future systematic reviews and meta-analyses a lot easier and a lot more powerful.
Absolutely. Yeah. One of the exciting things with systematic reviews is usually they will critically appraise all of the articles and say the quality based on very specific criteria that all clinical trials should have, such as was there randomization, and if so, how did they randomize, was there blinding, all of those types of things. But in this review, what happened was we came up with another set of criteria that defines in a massage therapy article what different criteria should be included based on the massage, such as who did the massage and what were their qualifications, what body parts were actually massaged, what type of massage was it, how long, in terms of minutes was spent on each of the different body parts. So there's lots of different criteria we want to see in the future that we assessed in the articles that we did find.
I'm so excited about that, and we will devote another research perch to that.
Yeah.
To that outcome.
Yeah.
On another day. But so thanks for sort of, orienting us to where this kind of article fits in the research pyramid. And so just to what we're going to do now is sort of dig into what it says, and to do that, I'm going to just give a little overview of the introduction and research question. So the research question is basically, what is the state of the evidence? What is the evidence up through 2014 say about the impact of massage therapy on pain and function in these populations? So that's the research question. Mm-hmm. What the way the article approaches this is to look at, historical information about massage therapy and also the problem of pain in our medical community, which, the timing of this has worked out amazingly because, of course, the issues that we have that are now being recognized with opiate addiction are really gathering a lot of attention, and people are so committed to finding alternatives, other ways to manage pain other than drugs. And so the timing is just right for people to be excited to hear, what the alternatives are and if they can be helpful. So that's the overview of the research question. And Geraldine, if you want to just walk us a little bit, we could do, we actually, Geraldine and I have taught a 4-hour class on this. And we're not going to make it a 4-hour research bird. But if you want to talk a little bit about the methods and for how the team pulled all this together and then what their findings were. Again, we want to really point listeners to the article itself, but this will help you unpack this a tiny bit.
Yeah, I'd love to. And like Ruth said, you can absolutely read this article on your own so that you can get more specifics about how this all happened. But the first thing that usually has to happen in a review article is a definition of the keywords. And so the first thing we had to do was come up with, well, what does massage therapy mean? What, when we look at articles, how do we know that it's actually massage or versus something else? So Ruth, remember going round and round with what exactly is massage? Look at her head. It was an interesting conversation that lasted for about, I don't know, maybe a couple hours, because we had to really definitively say in this article, here are the types of articles that we want that equals massage. And so some things had to be thrown out, some things were brought in, some things we had to debate at a later date as to, well, does this fit our definition or not? So then we came up with, or the team came up with eligibility criteria for being part of the review. And so things such as it has to be a clinical trial, which is the strongest single study design. It had to include a human population. There had to be massage based on this definition. There had to be some sort of a comparison group, whether it be no treatment at all, sham, a pretend type treatment, or an active comparison, such as physical therapy or spinal manipulation. So once, and
hang on. I want to add something here because from my perspective, it's really important. The other thing that we made absolutely sure is that in all of the trials that we included, the massage was actually done by a massage therapist or by someone trained by a massage therapist. So this is not, if you're not careful and you don't know what you're looking for in research articles, sometimes you'll see things about massage, but it's done by machines, mm-hmm. or done by people who have this idea about what massage is, but who are not actually educated in the profession. So we made sure that all the massage was done by massage therapists or by people, say, parents or loved ones who were by massage therapists.
And I think it also was, it included people who were trained to do massage. And so other healthcare providers who have been trained to do massage.
In massage. Yeah.
Right. So there were lots of different facets in this. I mean, you think about the research question that Ruth talked about, and it sounds so straightforward. It's not that straightforward. And knowing which articles can be included and excluded can be confusing at times. So coming up with these definitions before any search happens is really critical. So then the search happened, and they went through different search databases such as PubMed and CINAHL and Embase, and I forget what all the different ones were, PsycInfo, to find the articles that could be included in this trial or in this meta-analysis. And so they found a whole bunch. In this study, initially they found 3,678. Then they culled through that to see are there duplicates, and they then brought it down to, what was it?
It was close to 1,000. Was it 999?
They started at 4,099, and then they brought it down to 3,600. And then they went through and they started excluding articles that didn't meet the inclusion-exclusion. They ended up with 99. And when we got to that point, this was really exciting. They came to us and they said, listen, we found a lot more evidence than we ever thought that we would find, and we want to suggest that we divide this into 3 different articles. Remember that time, Ruth, when we got this call?
So for our listeners, I want to just offer some perspective here that in the world of meta-analyses and systematic reviews, having 99 usable articles is enormous. I've read really strong meta-analyses with 5 articles. Mm-hmm. And so, to have 99 articles that fit your inclusion criteria, which were pretty rigid, was a really surprising outcome. Mm-hmm. Which is why we were excited to say, yes, let's go ahead and divide this into 3 different articles. But so just for people to know, it was a much bigger group of inclusion than we had anticipated.
So we were super excited, and the Samueli group was super excited. So we started this off wonderfully. The 99 articles ended up being divided into 3 different categories. And so the article that we were talking about today is kind of like all populations. So any population that might come into a primary care provider's office with different types of pain categories, that's who's included in this one. But then the other 2 articles, one is looking at pain in cancer-related treatments and diagnoses, and also pain associated with surgical populations. So those are 2 separate articles. But in this one, we had 67 articles that were included in this meta-analysis. So once they narrowed it down to 67, they then did an evidence overview. So they looked at all of these different criteria to determine, are these good articles or are they not so good articles? And what they found was that 10 were of high quality, based on the Sign 50 criteria, which is a very popularly used criteria for article assessment. They found that 50 were acceptable and only 7 were low quality. So this is much.
Put that into context. Sorry to interrupt you, but put that into context with a systematic review in some other profession. Is that is that a similar kind of breakdown between strong and poor quality article?
Oh, so usually we see a lot more low quality articles, truthfully. And some of that is based on if the articles are older, they're going to be lower quality, because nowadays the acceptability of low quality articles is pretty much out the door. We, as consumers of research and also as editors, expect much higher quality in order for articles to get published. And so having only 7 that were low quality out of 67, that's amazing. That's unusual.
Cool, thanks.
Yeah. So what they ended up doing then is dividing these articles into different categories. And so the one outcome measure that was very consistent across all articles was pain, so measuring pain. And they looked at pain in groups, in studies where it was massage versus no treatment. And they looked at pain in terms of studies that were massage versus sham or pretend. And then they also looked at pain in terms of studies where it was massage versus another active comparator. And they gave the results of those 3 different outcomes or different study designs.
So I just want to define active comparator.
Sure.
An active comparator would be another specific intervention. So it could be medicine, it could be exercise, it could be chiropractic, it could be yoga. I mean, these are all examples of active comparators, right?
Right. And so if we look at those results, there actually were the most studies looking at pain with massage versus active comparators. There were, I forget how many studies, there were quite a few of them. But what they found was that it was almost significant. The p-value, which is an indicator of statistical significance, was 0.053. So usually the cutoff is 0.05 and lower for saying something is statistically significant. This was not, it was so close. One more study probably would have put it over, one more positive study would have probably put it over the edge. But when you look at these charts, they're called forest plots. You'll see different bars, and it's based on different articles, and you can see whether an article favored massage, the outcomes in massage treatment group versus the active comparator. So I encourage you to take a look at the actual article to see where these different studies fell. And it also has indications as to what the active comparator was, whether it be manipulation or physical therapy or any of the other active comparators. And for this, because there were so many studies, they were able to do meta-analyses for a couple of different outcome measures, just in this one. One of them is mood or anxiety. There's been some other studies looking at this specific fact or this outcome measure. And what they found was that massage did statistically significantly reduce anxiety compared to other active comparators. And so massage was a better way to go in terms of anxiety. They also looked at range of motion and health-related quality of life, did not find significant outcomes. It was leaning towards that in terms of the p-value, but it was not indicated as statistically significant. So that was not seen. So more research needs to be done with active comparators. Ruth, do you have anything to say about that?
Yeah, I have a couple of things to say about that. Well, we'll talk more about this when we talk about how to apply this in our practice. But I want to make it clear that the fact that massage therapy was not statistically significantly better than these other things doesn't mean that it doesn't work. Mm-hmm. It means it works, within the same range as these other things. And so the way this works for application is, our clients come to us because they prefer massage to doing nothing, or they prefer massage to taking medication. or something. And so it's good to have a way to say, well, all right, here's what the data says about how, how these things back up. Mm-hmm. So, yeah, that's all I need to say about that.
Okay. The two other outcomes that we looked at or in this article was massage versus sham for pain. And what they found was that massage was statistically significantly better than a fake procedure in terms of improving pain. And the other was looking at massage versus no treatment. And of course, massage was statistically significantly better than no treatment at all, with a very significant outcome with that. So, the results were very positive. The articles were very strong. This was a really interesting article in terms of the outcomes. So I encourage all of you to take a look at it, muddle through. Let us know if you have questions about anything that they say in there. They use a lot of research language, which sometimes gets confusing, but we're happy to help unravel any of those points of confusion. Ruth, would you like to talk about any applications with this article?
So I actually sort of jumped the gun a couple of minutes ago when I said what I said, but I want to make it really clear. So what we have again, just to synopsize what Geraldine just said, is a thumbnail sketch of this is we're comparing massage therapy for pain and function to three different things. We're comparing it to no intervention, to a sham intervention, and to a whole slew of different possible active comparators, which could include PT and chiropractic and medication and whatever. And what we saw is, not surprisingly, massage compared to nothing gets better results. Massage compared to sham gets better results. Massage compared to active comparators gets about the same results. Is that fair?
Yep.
Carolyn, right? I mean, it was just right. It was almost the what's the word I want? The
p-value?
Yeah, but the strength of massage compared to these things was almost better, but not quite, right? It was close. Yeah. But remember, all those things are all lumped together. We didn't do it specifically, compared to individual possible comparison. Mm-hmm. But for our clients, we will have clients come to us who are contemplating knee surgery because their knee hurts so much, but they really, really, really don't want to have knee surgery. And this is an example where we can show them that if they're not, if surgery is off the table and they want to not be taking heavy duty pain medications, here we have some data that suggests that massage is a decent thing to consider, is a reasonable thing to consider, and something that their healthcare team would probably support. If you work in a setting where you are dealing with other healthcare providers who are really interested in non-narcotic pain management, boy, this is a study that could really carry a lot of weight. We're not saying, and nobody should interpret this as to say that massage is as good as opioid drugs. It's apples and oranges, isn't it? But for looking for non-narcotic pain control, what this study shows us is that this is a really good option to consider. And I am eager in the future to look at, these active comparators and maybe pick those apart a little bit more, but we'll come back to that thought. So, there's all kinds of practical application uses for this, even though it's very large scale. It's less about this is the kind of massage that appears to work for knee pain, or this is the kind of massage that appears to work for neck pain. That is the focus of, is massage therapy a viable option for people who live in pain? And the results, these results aren't surprising to us, but until you really look at it carefully and are willing to kind of peel back our assumptions, it's not fair to make blanket statements about massage therapy and pain. And now we have, some better grounding helps us to make our case. So that's my input about application on this information.
And I think one thing that wasn't discussed by us, but that is in the article, is safety outcomes.
Yes.
There are many safety outcomes in these articles, and it demonstrated that massage therapy is considered to be very safe. And so this is an article that if you want to start collaborating with primary care providers, this would be a wonderful article to bring them, because it really talks about not only pain control, but also that this is a safe option for their patients in terms of if they have pain, and that this is a safe type of treatment. Mm-hmm.
Right. It was something that, at least, my impression from our conversations with the people at Samueli is they were really, really impressed with, not only with the fact that massage therapy is demonstrably quite safe compared to other active interventions, but that by and large, we're pretty good about reporting on that. And so, in that aspect.
Mm-hmm. So we have to wrap things up, but one thing that Ruth and I thought that might be fun is to leave you with just a couple of questions to consider. So whether you are a classroom of students or a group of massage therapists sitting together watching this, or just as an individual, here's a few questions that you can think about in your own brain or amongst each other, just in terms of this research article. So question number 1, Ruth.
Sure. So we've been talking about these results for massage therapy versus active control. And as we've said, those active controls can be a lot of different possible interventions. And because of the nature of this kind of review, they were all lumped in together. Mm-hmm. So we would like to ask, what would have happened if we had played those out and we had looked at the comparisons, sort of comparator by comparator. So massage compared to chiropractic, massage compared to physical therapy, massage compared to medication. So we would love for you to dig into this paper and see what you can find out about that. The other thing I'll say about that, and Geraldine, you and I didn't talk about this in our preparation for this podcast, but one of the value adds to this project that we did with Samueli was the creation of this database. So we now have available to you, and we'll put up the website for this, a database that can take you right to the source material, the articles that were used to compile this information. So if you're really interested in what the research says about massage versus X, Y, or Z, as it's discussed in this article, you can dig that up because we have the database available to you. So I'm going to recap the question. In results for massage therapy versus active control, what might have happened if each of these active controls had been analyzed separately?
Good question. And I think it kind of feeds into our question number 2, which is, what would have happened if they divided out the different conditions into different sections? And so in this study, one thing we didn't really talk a lot about with you today, but you'll see in there is that all different types of pain conditions were lumped together. And so if we separate them out, might we get different results in this systematic review?
Right. So, as Geraldine said, we ended up creating these 3 categories. The paper we're talking about today is by far the biggest, the general populations. And then in future podcasts, we'll talk about the one about people who live with cancer and the one about people who are undergoing surgery. The people who don't fit into those categories, pain populations, we have things, anything from arthritis to fibromyalgia to a number of other things. And people who know me know I'm all about the conditions. So I would be really interested to see to play out these different subheads.
Mm-hmm. And with the database that we have on our website, you can feel free to start searching that for different conditions. If any researcher or teacher would like to do a systematic review that is smaller in scale based on condition specific, please feel free. We really could use that within our profession.
Oh, we'd love it. That would be awesome. And the search criteria, the definitions, all of that is preset. I mean, that we have set up a structure that will make it much easier to do future systematic reviews.
Yes.
That
is so cool.
Which actually is a nice lead-in to our last question, which is, what does this make you want to ask? What, when you think about this kind of project, what questions do you have about massage therapy and pain and function, and how would you like to follow that up? And we invite you to let us know what this makes you curious about, but also to maybe, think about using this structure, the definitions and the search criteria, to poke around on your own and see what kinds of conclusions you can come to. So what does this make you want to ask next?
I like it. A lot of questions. Well, we need to close up this issue of Research Perch. Thank you so much for joining us today. We'd like to thank American Massage Therapy Association for funding the Massage Therapy Foundation so that doing these series of meta-analyses was possible. And we'd like to thank all of you for joining us today. We think this is a lot of fun. Let us know if you have any questions or comments, and we'll see you for the next podcast.
Bye.
Bye. Thank you.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.